Our body is wired to detect danger and protect itself from serious harm. Pain is a built-in alarm to alert us of dangerous situations. Our pain system does a relatively good job at alerting us when there is an acute injury, like a burn, a bone fracture, or appendicitis. However, pain is not a good thermometer of how much harm there is in the body. In some situations, the brain will not stop alerting the person of danger, even when the injury has already healed, and hurt will be interpreted as harm. But you may be thinking, is there any problem with that? Yes, because if you feel pain and you think that pain is a thermometer that something is being harmed in your body, you don't do the things that promote healing. Actually, you will be doing exactly the opposite. So let's talk about hurt versus harm today. Before I continue, let me remind you that this video is not intended to provide medical advice. If you have a condition that causes pain, please talk to your doctor. This video is only for educational purposes. And if there is an emergency, call an ambulance or go to the nearest emergency department. If your doctor told you that the injury, the disease, or the condition that started this pain is already healed, then why do you still have pain? Well, any feeling of pain is just that, a sensation. It does not mean that when it hurts, there is something harming your body. If you have persistent pain anywhere in your body, don't try to diagnose yourself. Get a medical opinion and a proper diagnosis. Your doctor or your therapist will confirm that there is no more ongoing injury. So if this is your case, you should be happy. You can be reassured that there is nothing harming your body. Of course, pain is unpleasant. It's annoying and tiring. I understand that, and I'm not telling you that you need to have the pleasure of feeling pain. No. But the problem is that people who fear pain because they think there is harm to their body, they avoid activities that actually promote healing. And the main modality that promotes healing and avoids the transition from acute to chronic pain is movement. Watch my other video about the difference between acute and chronic pain. Movement. Fear of movement is very common among my patients. This is what we call kinesiophobia. It is a phobia of movement. They avoid exercising or using that body part. There is a questionnaire that I use with my patients. It's called the Tampa Scale for Kinesiophobia. The higher the scores, the more fear of movement the patient has. Here are some examples of questions. I am afraid that I might injure myself if I exercise. My body is telling me that I have something dangerously wrong. Pain always means that I have injured my body. No one should have to exercise when he/she is in pain. Well, there is a lot of research showing that among people with the same type of injury, those who have higher levels of kinesiophobia tend to suffer higher pain levels, have more disability, and worse quality of life. Younger women tend to have higher scores than older women. When we screen our patients for kinesiophobia and we address these beliefs during rehabilitation, the patients recover faster and achieve a much better quality of life. When patients fear movement, they tend to become more hypervigilant and avoid activities which will lead to more muscle weakness, poor balance, poor coordination, and endurance. They will have more disability and depression. Then the person feels worse, and this cycle just perpetuates itself. When the person loses the fear of movement, they can confront activity. They engage in normal daily activities and recover much faster. Pacing. When you understand that hurt does not mean harm, you get too excited and want to do a lot of activities that you were avoiding, like gardening in the morning, cleaning the house in the afternoon, and grocery shopping in the evening. Maybe you need to pace yourself. There is no need to rush. Pacing means that you will respect your limits. You can break down an activity into small steps. You can rest and take it easy. Taking breaks improves your overall performance and speeds up your rehabilitation. Have you heard the story of the two woodcutters? They were in a competition to see who would cut more trees in a day. One was an older woodcutter with many years of experience, and the other was a young and stronger man, but without the same experience. After 1 hour of chopping trees, the older man stopped to rest and invited the younger man to do the same. The younger replied, "No way, I don't need to stop." The older man kept taking breaks every hour. At the end of the day, the younger man was astonished to find out that the older man had cut many more trees than him. And he went to ask the older man what his secret was. The older man replied, "Every time I stopped to rest, I sharpened my axe." So the secret is to find balance. Do not be afraid of movement that you will be paralyzed by fear of harming yourself, but respect your own limits and pace yourself. Well, if you like this video, don't forget to like it here and leave your comments below and share it with your friends using this button here. Goodbye.